Phoenix Children's Hospital is one of the largest children's hospitals in the country. With a medical staff of nearly 1,000 pediatric specialists, Phoenix Children's provides inpatient, outpatient, trauma, and emergency care across more than 70 pediatric subspecialties. Over the last several years, Phoenix Children's has added new capabilities, operational sites, and physicians, including new ambulatory practices. With this expansion came the task of adding all ambulatory sites, specialties, and users into Phoenix Children's Allscripts Sunrise EHR. Known for its innovative, nationally recognized healthcare IT department, Phoenix Children's saw these challenges as an opportunity to make enhancements to their existing EHR and made the decision to add Medicom Systems' documentation tool, Quippe, to enable faster integration of EHR users and sites and improve usability and workflow across the enterprise.
We've had the Allscripts Sunrise product for many years in our inpatient environment, and in those environments the doctor can often spend half an hour or an hour completing the documentation with lots of time and kind of the ability to do it. But in an outpatient environment, which we were just getting ready to put our system into, the time's of an essence, and so we were very focused on how many minutes every single visit took and cutting out unnecessary minutes during the outpatient stay. So when we saw Quippe, we thought, here's a product not only will get us very structured data, but also a product that's very, very quick and appealing to use. We are able to see more patients in our clinic because of Quippe, and that's the end of the day what makes a difference in a children's hospital. There are children who are now being cared for that couldn't. We have some clinics that have many months wait to get in the clinic, especially the specialty ones. So being able to see more patients, support the physicians better in their day-to-day work, it was really the number one benefit for us.
We realized that templates could be a complex challenge for the physicians who just did not want to spend their time building content, editing it, and building a new template every time they saw a new patient.
So our physicians come from all different areas, and oftentimes we're acquiring practices. So you have people coming in with experience of lots of different systems and lots of different ideas about how things can be done. And what was been nice with Quippe is kind of unified them in their love of a documentation system.
Quippe makes training very easy. It's a web-based interface. Everyone knows how to work a web page. They know what browse means. They know how to click and drag. If you can do those functions, you can use Quippe in a very easy amount of time.
It's a matter of learning how to just open it, pretty much. It's extremely user-friendly and intuitive.
Why do providers repulse against EHR? Because A, it's change, and B, it's scary. But when you put Quippe in front of them, that fear goes away because they know what Word looks like. It looks like a Word template. They know if there's a box they can click in it.
Certainly the feedback we've been getting is great. I was actually in the resident lounge in our general pediatrics clinic about 3 months ago installing something. They didn't know who I was, putting a piece of equipment in there, and I heard one resident tell the other, we were in an epic hospital last week and this documentation here is just so much better and easy to use. And really that's the kind of feedback that's unsolicited, just two residents talking backwards and forwards with each other.
And it really hit the spot. This was exactly what we were looking for: flexibility, ease of use, removing the burden from the physicians, and it met our requirements of being able to launch our ambulatory EMR in a very quick, rapid, and efficient manner. We knew that this platform was very open, it had an open architecture, and we have built quite a few enhancements that have improved patient safety and quality on this platform.
You can create a custom template on the fly with being just an average user. There's a shell that's just kind of an outline of what a note should be.
We live in the information age, and it's important with handoffs with patients that the doctors that come after us know what we talked about with the patient the day before or the treatment plan that we put in place to see if that's working.
It just really replicates how doctors think. It can replicate the note that you've been using in the past because it's very customizable and you can just choose the features that you want to include.
As soon as we hit enter, all the different remote sites within Phoenix can have access to that information as well.
We actually used to use several different programs, so we would document on paper and then go into a program to actually do billing. Quippe has now allowed us to do all in one type of documentation and billing within the Quippe note.
I'm happy to say 1 year later, Quippe has been completely integrated into our Allscripts product. It is completely seamless and transparent to the end user.
It's happy providers and happy patients. Patients want to be seen in a timely manner and they want the attention of their doctor. Doctors want to provide high quality care and want time with their patients and want a good documentation, so I have efficient build, I have happy providers, and I have happy patients. What more can I want?
Try and get your EMR vendor to integrate Quippe into their product. It's a wonderful solution. I haven't really seen any other documentation tool that's as good as Quippe and stand up against anything that's out there.